I think the first thing that we can extend to another human being, be it someone close to us or not, is to be a good listener, to be non-judgmental in the sense of the morality or ethics of the situation. I think also we have to be patient with them, and other qualities that we ourselves should begin to be educated about the particular kind of mental disorder that other human being might be suffering from. I think we have to be aware of the location of resources and facilitate access, and to be there by and large to lend support. The state continues to do its work in allocating resources. I make a plea, however, to the powers that be, that from 4% of the health budget which is allocated to mental health, I really wish we could bump that up to about 7 or 8% in the next for the next budget presentation. With that money, I would like to see the establishment of child and adolescent mental health units in every regional health authority, because my thinking is that if we could catch it early in our children, nip it in the bud, we wouldn't have them presenting as adults to congest our mental health clinics in the future. That's one thing for sure. Take the advice of PAHO and integrate mental health care in primary care. I think that is something we've been considering, and perhaps now is the time to courageously try and implement that. I think also that we need to have opening up in our RHAs jobs for our clinical psychologists. Quite honestly, we have established a training program since 2006. The first set of graduates may have come out at 2010. And what's the rationale for establishing a training program, training clinical practitioners in psychology, and then not being able to absorb the graduates in the public health sector to make an impact on incidence, prevalence, morbidity, and mortality in mental health? Because we have the resources, we have the expertise, and if it's there in the country and it's not being utilized, we sure are missing a very big opportunity to make a dent in mental health. Again, going back to the history of medicine and the history of how health was addressed by medicine in probably the 15th or 16th centuries. Ill health and mental health in particular was regarded as almost like a curse from on high, from the heavens, from God, and it was demonized. And I think that is how the stigma began to be attached, that if you have epilepsy, for example, that would be a sign that that person may have been possessed with the devil or some unclean spirit. And those kinds of preoccupations and ideas die hard even today with its so-called civilized, in quotation marks, a civilized society. I think there's a persistence of treating the mentally unwell as if they too are responsible for incurring the wrath of God, and there's something morally defective, and I think that's how we come to maintain stigma and treat the mentally unwell. But people may be mentally unwell, but they still have a sense of respect for themselves, and by going to the mental health clinics, they don't want to be treated with suspicion and ridicule, and I think that sometimes contributes to preventing access to the mental health services. I would like young clinicians to join with the Trinidad and Tobago Association of Psychologists, especially in their outreach programs. I'd like very much more governmental support to the Association of Psychiatrists of Trinidad and Tobago, APTT, for PNAT, the Psychiatric Nursing Association of Trinidad and Tobago, and for the Trinidad and Tobago Mental Health Association. I think these bodies have been most times very quiet, working in the background, and I think one of the biggest challenges is funding and support from the Ministry of Health and from the government. And I think if we can get some encouragement and support to these bodies, we certainly can do more for the mentally unwell in our country.